Half of all men over 50 will face some kind of prostate problem in their lifetime. That statistic alone should grab your attention because it means you or someone you know is likely dealing with this right now. Most people think medications are the only solution, but that's not the complete picture. There are simple exercises you can do at home that can make a real difference in your prostate health. I'm Dr. Isabel Lopez, and I specialize in men's health issues, particularly those affecting men in their golden years. I've seen thousands of patients who wished they had known about these natural approaches earlier in their journey. Today I'm going to teach you 5 practical exercises that you can start doing immediately in the comfort of your own home. These aren't complicated gym routines or expensive equipment programs. Before we dive in, I want to know where you're watching from today. Drop your city in the comments below because I love connecting with viewers from around the world. Make sure to follow this channel because I share evidence-based health strategies specifically designed for men over 50. Your prostate health doesn't have to decline with age if you take the right steps now. The first exercise I'm about to show you targets your pelvic floor muscles directly and can start improving your symptoms within days. This movement activates multiple muscle groups that support your prostate and bladder function. You'll feel the difference in your daily comfort and control. Let me show you exactly how to perform the bridge exercise that could change your entire routine. The bridge exercise is one of the most effective movements for strengthening your pelvic floor while being gentle on your joints. You simply lie on your back with your knees bent and feet flat on the floor about hip-width apart. Slowly lift your hips up by squeezing your glutes and engaging your core muscles. Hold this position for 3 to 5 seconds before lowering back down with control. This movement specifically activates your glutes, lower back muscles, and most importantly, your pelvic floor muscles. These are the same muscles that support your bladder and help control urinary function. When you lift your hips, you're creating a natural strengthening pattern that mimics how these muscles work together in daily activities. The bridge also improves blood circulation to the entire pelvic region. The benefits go far beyond just muscle strengthening, though. Improved circulation means better nutrient delivery to your prostate and surrounding tissues. You'll likely notice less pressure and discomfort, especially when sitting for long periods. Many of my patients report better urinary control within the first 2 weeks of consistent practice. Start with 10 repetitions and gradually work up to 20 as you get stronger. You can do this exercise once or twice daily without any equipment needed. The beauty of the bridge is that it's low impact yet highly effective for your specific needs. But strengthening is only part of the equation, which brings me to our next exercise that focuses on releasing tension in your pelvic region. The butterfly stretch might look simple, but it's incredibly powerful for opening up your hip flexors and improving pelvic circulation. Sit on the floor with the soles of your feet together, letting your knees fall out to the sides naturally. Gently hold your feet with your hands and sit up tall through your spine. You should feel a comfortable stretch through your inner thighs and hips, not pain. This position directly targets the muscles and connective tissue that can become tight and restrict blood flow to your prostate. When your hips are tight, they can create compression in the pelvic region that makes prostate symptoms worse. The butterfly stretch counteracts hours of sitting and helps restore natural mobility to this crucial area. Think of it as creating space for better function. Stick with me until the end of this video because the exercise combinations I'll share create a complete system for prostate health. The improved circulation from the butterfly stretch means less congestion in the prostate tissue itself. You'll find it easier and more comfortable to sit for extended periods. Walking and general movement will feel more fluid and less restricted. Hold the butterfly position for 30 to 60 seconds and repeat 2 to 3 times. You can gently press down on your knees with your hands for a deeper stretch, but never force it. Breathe deeply during the stretch to maximize the relaxation response. The next movement takes this concept further by adding dynamic motion that actually massages your prostate from the inside. The cat-cow movement comes from yoga and creates a gentle massage effect for your entire pelvic region. Start on your hands and knees with your wrists under your shoulders and knees under your hips. 4. The cow position. Arch your back by lifting your chest and tailbone toward the ceiling. Then transition to cat by rounding your spine toward the ceiling while tucking your chin to your chest. This alternating movement creates a wave-like motion through your spine and pelvis that stimulates the nerves connected to your bladder and prostate. The gentle flexion and extension helps release tension that builds up from poor posture and prolonged sitting. Each movement cycle increases mobility in your lower back and pelvis while promoting healthy nerve function. The benefits extend to your entire urogenital system because of how interconnected these body regions are. The rhythmic movement helps reduce stiffness and promotes natural lubrication in your spinal joints. You'll notice improved flexibility not just in your back, but in your ability to move comfortably throughout your day. This exercise is particularly helpful if you experience lower back discomfort along with prostate symptoms. Perform 8 to 10 slow cycles of cat-cow, taking about 3 seconds for each transition. Focus on smooth, controlled movement rather than speed or extreme ranges of motion. The key is consistency and gentle progression over time. Our next exercise takes a completely different approach by using your wall to build the foundational strength that supports your entire pelvic region. The wall sit exercise builds incredible strength in your legs and core while specifically targeting the muscles that support your bladder and prostate. Stand with your back against a wall and slide down until your thighs are parallel to the floor, as if sitting in an invisible chair. Your feet should be about 18 inches from the wall with your weight evenly distributed. Keep your core engaged and breathe normally throughout the hold. This isometric exercise forces your quadriceps, glutes, and deep core muscles to work together in the same way they support you during daily activities. The sustained contraction improves endurance in these supportive muscles while promoting blood flow to the pelvic region. Your body learns to maintain proper alignment and muscle activation patterns that carry over into your regular movements. The strength you build here directly translates to better bladder control and reduced urgency symptoms. When your leg and core muscles are strong, they take pressure off your pelvic floor muscles, allowing them to function more efficiently. You'll find it easier to get up from chairs, climb stairs, and maintain good posture throughout your day. This foundational strength is crucial for long-term prostate health. Start by holding the wall sit for 15 to 30 seconds and gradually increase the time as you get stronger. Aim for 3 sets with short rest periods between each hold. If 30 seconds feels too easy, you can progress to longer holds or add small movements like marching in place. The next exercise is the most important one because it targets the exact muscles responsible for urinary control. Kegel exercises directly strengthen your pelvic floor muscles, which form a hammock-like support system for your bladder, prostate, and rectum. To find these muscles, imagine stopping the flow of urine midstream or preventing the passage of gas. Contract these muscles by lifting them up and in, as if pulling them toward your belly button. Hold for 3 to 5 seconds, then relax completely for the same amount of time. These muscles become weaker with age, surgery, or prolonged sitting, leading to the urinary symptoms many men experience. When you strengthen your pelvic floor, you're directly improving your ability to start and stop urination, reduce urgency, and prevent leakage. The beauty of Kegels is that they work on the problem at its source rather than just managing symptoms. The benefits extend beyond urinary control to include improved sexual function and core stability. A strong pelvic floor contributes to better erections and enhanced sensation during intimacy. You'll also notice improved posture and reduced lower back pain as these deep muscles provide crucial spinal support. Many men are amazed at how much better they feel overall when their pelvic floor is functioning properly. The best part about Kegel exercises is that you can do them anywhere without anyone knowing. Perform them while watching television, driving, or sitting at your desk. Start with 10 contractions 3 times per day and gradually increase the duration and repetitions. Now let me show you how to combine all these exercises into a simple daily routine that fits into any schedule. Join the Members Club and drop a super like on this video if you're ready to take control of your prostate health naturally. Creating a consistent routine with these 5 exercises takes just 10 minutes per day and requires no special equipment. I recommend doing the bridge and wall sits in the morning when your energy is highest then the stretches and mobility work in the evening to help you unwind. Kegels can be performed throughout the day whenever you think of them. The key to success is consistency rather than intensity, so start with shorter durations and fewer repetitions. Your body needs time to adapt and strengthen gradually, especially if you've been sedentary or dealing with symptoms for a while. Track your progress by noting improvements in urinary control, comfort during sitting, and overall energy levels. Small daily improvements compound into significant health changes over time. You don't need expensive gym memberships or complicated equipment to support your prostate health effectively. These exercises work because they address the root causes of prostate problems rather than just masking symptoms. When you combine proper movement with consistency, your body has a remarkable ability to heal and strengthen itself. The investment of 10 minutes daily can pay dividends in your quality of life for years to come. The strength of your health truly lies in the small daily habits you choose to maintain. Comment below if you already practice any of these exercises or if you're ready to start your 10-minute daily routine. Follow this channel for more evidence-based strategies specifically designed for men's health after 50. Your prostate health journey starts with the very next decision you make about taking action.